Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on KHTS, your hometown station. And our guest now, it will be Bob Sheritz, who is founder of Way Out Recovery Center. Welcome, sir. How are you?
I'm doing well. Sorry to rush on in here like this. I appreciate you having me on the show today.
Well, tell us about Way Out Recovery Center.
So, I'm short. I need to raise my seat. The Way Out Recovery Program is an intensive outpatient program. Our primary population is adults and adolescents and their families. So we provide group and individual counseling, drug testing, interventions, things like that, education in the community. We've been open less than a month. We're located Plum and Bouquet, so 28118 Bouquet Canyon. And our phone number, let me give you a phone number and website for any listeners, 661-296-4444. And our website is thewayoutroveryscv.com.
Wayoutroveryscv.com.
Correct. Thewayoutroveryscv.com.
So, Bob, this is the Senior Hour, but what are we recovering from? I mean, are we talking about alcohol, drugs? I mean, which kind of the same vein? Are we talking about PTSD and our veterans? What does the Way Out Recovery Center do?
Well, we are a substance use disorder primary treatment center. And so our primary focus is substance use disorders, whatever drug that may be, whether it's alcohol or any other drug. Mm-hmm. However, we do specialize in any type of addiction. Mm-hmm. And a lot of times, I mean, you mentioned PTSD. A lot of times we have people that come in that are using drugs that need help getting off that. But underneath that are issues like PTSD, yes, mental health issues, abuse, trauma, neglect, all that kind of stuff comes mm-hmm. hand in hand with addiction.
Depression, loneliness. Yep. I mean, there's a whole bunch of factors that I've seen my friends who were in Vietnam have to go through in life, and some of it, of course, now is labeled PTSD, but it wasn't recognized. And, they had to go through the whole gamut, and the realization from counselors and others who said, hey, you've got this, and that's why you're drinking, that's why you're using drugs. Right. And once that realization came, recovery was a lot easier.
Well, it certainly is a sign of the times that we're talking about post-traumatic stress disorder, mm-hmm. that we are able to recognize the signs and symptoms of that. Because you're right, after the Vietnam era, it really wasn't very well known, and people mm-hmm. just went around with all these nightmares and visions and stuff that they lived with, these demons that they lived with. And one of the ways to cover that up is to drink or use drugs. Mm-hmm. And so we treat the primary issue once a person comes in. So you can't begin to look at, let's say, PTSD, for instance. We can't really begin to look at that until we achieve some sort of stability in the drug use. Mm-hmm. So a person comes into our center, we teach them let's get them off the drugs, and mm-hmm. then let's get a baseline. Now we can start. We have our clinical director is a marriage family therapist by the name of Brenda Way, and she is really outstanding in uncovering and helping people work through those underlying issues, such as PTSD or the depression that you mentioned or any of the other mental health components. Mm-hmm. And so once a person is freed from the drugs, then our work is to look at those underlying issues. Because mm-hmm. let's face it, if you get rid of that stuff, there's no need for the drugs. Mm-hmm. There's no need for the drugs anymore.
And then, as a medical doctor, I know that, sometimes when you start using drugs, there is a addiction. I mean, it's not just a psychological addiction, it is a physical addiction. And, we have to deal with that also. I mean, they would call it demons and all these other things, but scientifically I know there are like brain receptors and opiate receptors and things that if you don't do certain things to cover those up, then you go through withdrawal, or things start to happen and you get the cravings for having that drug even more to cover the receptors. So there's a lot of things that go on that physically and psychologically that are taking place in those who are addicted that must be recognized. But how, Bob, that recognition, how, if somebody is listening right now, a grandparent, and they say, my grandson, his behavior is off, he's doing certain things, he was in the war, or, he grew up in a different way, how does that person say, hey, you tell that person you need help? How does that recognition come to fruition?
Well, sometimes it's as simple as that. Sometimes it's as simple as saying, hey son, hey daughter, hey sister, brother, husband, wife, I think that there's a problem here. Here's what I've been seeing. Can we talk about that? Here's what I think is going on. Sometimes it's certainly not that simple. Yeah. And many families have trouble. I think many people have trouble talking about difficult issues like addiction, drug use, things like that. Absolutely. But especially when it's in your family. One of the things that I like to say publicly anytime I have a chance to speak is, if you're sitting out there and you need help, or a loved one needs help, reach out and ask somebody. Start somewhere. There are many terrific resources that are probably sitting right in front of the families and they don't even know it. A pastor at your church, a doctor, your primary care physician, the local hospital, sheriff's department, school district. There are many, that's just to name a few. There are many, many, many entities in front of you. And then, of course, there are addiction professionals like myself and the organizations that are in Santa Clarita. And one of the things that we do is we specialize in interventions. So if somebody needs to have that talk and they don't know what to do, give us a call, or give somebody a call that can help have that conversation with your loved one.
With Al-Anon and AA, you go into the meeting and you stand up and you say your name and I'm an addict or I'm an alcoholic. That initial admission is the most important thing. Right. Because certainly people around you might recognize it, but until you say, I'm an addict, I need this medication or this drug or alcohol, that I think is a big hurdle. After you start that, your next step is to maintain and sustain yourself around people who will help you out. And that's another difficult task, to stay within the guidelines of what you're supposed to do to stay off of drugs. And it's not an easy task, and some people just don't want to meet that challenge, do they? Right.
Well, it's like any other chronic disorder. Or any other disorder. First of all, a person has to, on some level, recognize that they have a problem. They may not be able to name that problem. They may not be able to say, I'm an addict or I'm an alcoholic. And there are some myths surrounding what gets people into treatment. You'll hear people say, well, they have to want it. They have to admit it. They have to do all this stuff, right? But I'm of the belief, because I've worked with enough people that have been seemingly forced into treatment by legal consequences or child services or a family member or threats of divorce or loss of job or whatever. They have some sort of an intervention that happens, whether it's on purpose or otherwise. And as a result of that, they're forced into a treatment program. And inside that treatment program, they hear things that they've never heard before. Education on what addiction is, or how do I ask for help? And somewhere in that process, they go from being forced to do it to wanting to do it. And then comes the admission. But like anything else, if I don't know I have a problem, why would I ever apply the solution to it, right? So admission is the first step. And once that happens, we free a person of their physical cravings first, make sure they're medically safe. Some drugs are more dangerous than others. Interestingly enough, society-wise, we tend to minimize the effects of alcohol, but medically speaking, alcohol is the most dangerous drug there is.
And you can just walk down the street and buy it. Right. And nobody says, you're under arrest.
That's correct.
Isn't that amazing?
That's correct.
That's right. And what's interesting too, veterans especially, so many of them are put on opioids. And opioids will kill you.
That's correct.
They will destroy every organ of your body. And it's very interesting because there's been some research going on about getting veterans off opioids onto medical marijuana.
Correct. That is well,
Yes, I realize that. And when I was going through my chemo a few years ago, the doctor prescribed hydrocodone.
Okay.
My son came to visit, and he saw the pill bottle on the table.
And he's like, hold on a minute.
He said, throw that away. He said, that will kill you. He said, let me get you some medical marijuana.
Right.
He has a dispensary.
Right.
And he also said the majority of his clients are veterans who were originally put on opioids, hydrocodone, all of those intensely grave
Right.
drugs that will kill you. And he is treating them with medical marijuana. And they seem to be doing so much better.
Yep.
There is, I mean, that's a hot ticket item right now, isn't
Very
it?
hot.
That's a very big conversation in and of itself. And certainly everyone who's in my profession and probably in the medical profession as well and otherwise are really doing the research right now to see and educate the public. We at the Way Out right now, we are currently in we're having treatment team meetings and writing a curriculum to educate the Santa Clarita Valley excuse me, on what is effective use of medical marijuana, what is dangerous use of medical and recreational marijuana, when does it become a problem, when is it effective, when is it not, and so right now the jury is still out on that.
Absolutely.
However,
But I think
you make a good point.
What's going to happen is people are going to realize the danger of the opioids, the hydrocodone and all of those, and start moving more toward medical marijuana under a doctor's guidance.
And
I
here-
don't believe in recreational. I do not believe in that, but I do believe in the medical marijuana. My pain disappeared after 2 days of taking those CBT pills.
Without any physical withdrawal symptoms.
That's right. That's right.
So,
It didn't bother me at all. When the pain was gone, fine. I stopped taking them. And I had no after effects, no long-term problems from that, which I would have from taking the other strong narcotics. And they
Realize
are.
as we try to advance forward on this that the medical profession, like I'm in, doesn't yet have all the guidelines that are there that are necessary to move forward with what we've talked about on this show many times, how we can start moving away from the opioids into the cannabis arena. And those guidelines aren't there. And we mentioned earlier about being able to go down the street and buy alcohol. Even in the United States, it is still illegal to have marijuana by federal government standards. California will change with the law being implemented, but the doctors, like myself, I'm a primary care doctor, but yet our education level and being able to say, hey, we can use marijuana instead of using opioids in this particular problem and assure that you're not going to be addicted. But doctors aren't educated that way yet, Bob.
Well, and the research isn't completely
Yes, and
out there yet.
that's part of the reason.
And when you were talking about the use of cannabis as a medication, you also mentioned the word CBD, which is an extract, and a lot of the medical uses for that particular extract, there's no THC content at all. So it's not like you're taking it to get high.
No, and if there is, it is such a small amount that it's not
Minuscule.
even noticeable.
And what's
'Cause
interesting,
I asked my son, I said, will this make me funny?
loopy, right?
And he said,
Funnier.
And he said, no. He said, Mom, there's a fraction of
Right. Right.
of THC in that. And part of that is involving the healing process.
Yeah, there's a little bit of a road ahead of us to try to get people to really separate recreational use from medicinal use.
Yes.
And it's difficult with this particular drug because unlike a lot of other drugs that started as medications and then started to be
Right.
abused, it's the other way around. You have a drug that is primarily always been used illegally for recreation. And now you're trying to sort of build a case on the efficacy of its medical purposes.
Isn't
And,
that funny how
you know,
we're doing,
yeah.
how this is evolving? I mean,
It
this is
is.
it's a great
very-
story, but I think it shows social adjustment to problems they've seen and the need to move forward
Right.
in solving the problem.
Right.
So, and I
Well-
think that's great that we as human beings as a society can do that.
Well, it's nice to stay open-minded because I would hate to close myself off to something that may be doing me good. And I've seen a lot of cases where people are, because of the stigma around any drug use at all, where there are cases of people doing exactly like you did, but they're afraid to talk about it because they don't want to be stigmatized. But offline, I'll talk to them and they go, "Oh my God, so I've gotten some amazing effects, and I've been able to cut out the use of some of these other more difficult narcotics."
Well, you won't keep me quiet on
Right,
that.
right.
Not at all.
Well, anybody, and what you said was your son came in and said, "Get rid of this stuff right here and let's get you over to this." One of the things that I think is important for us to put out on the air is that if you are on a narcotic medication, please don't just stop abruptly. Make sure that you consult with your doctor and say, "Look, I'm thinking about trying this other thing. What do you think? Can you titrate or wean me off of a medication?" Because whether it's a opiate like you're talking about, or something, another dangerous narcotics, or things like Xanax and the benzodiazepines. If you stop taking those kinds of drugs abruptly, you can have really severe withdrawal symptoms. And
That's
we want to be
very
careful, that nobody just stops taking their medication. Please consult with a doctor. And if your doctor isn't open-minded to possibly transitioning you to CBD or medical marijuana, talk to another doctor. You're the patient.
right.
You're in charge.
Well, fortunately, my doctor he gave me a prescription.
Yeah.
And my son took the prescription, and it was illegal medical marijuana.
Nice. Nice. Yeah.
And because he won't do it unless the doctor gives a prescription.
Well, and
sell
that's
it.
legitimate. I mean, some of the difficulties with cannabis is dosing. So it's hard. They've been selling medical marijuana in the lollipops and cookies and all kinds of stuff like that. And there hasn't really been any strict regulations on that. So if you and I are both using it medically and we get a cookie and we split it, because of the lack of regulations, you might get the really powerful half and I don't get the really powerful half. And we never know how much we're putting in our system, right? So I'm glad to hear that there's a doctor involved, that it's a legitimate dosing, that it's
Absolutely.
the CBD oil, that it's the extracts and things like that, because that's
That
wonderful.
cannabis oil is wonderful
Yeah.
for your skin also.
Yes, right. That's
Oh,
right.
my.
That's right.
And the medical profession has always looked toward the pharmacopoeia, which is how the medications, all medications are analyzed, assuring that 10 milligrams of something is 10 milligrams of whatever it is.
Right.
With marijuana now, when, like you say, you have a cookie, you don't know how it's mixed. You don't know how much is there. And I think, I find that, sometimes difficult to be able to say, oh, you need this, but not be felt assured that that's going to be the right amount or how much they should take in terms of their problem. So we were talking, the science is not there yet.
Right.
And I think we have to put all of the substances and analyze them so people can not only see a, Rocky Mountain fever or something like that and go in and say, okay, I want some of that, but say, I know how much cannabis I'm getting in that, how much CBD I'm getting in that. And that will help physicians become more acquainted with how to then prescribe it out. And I think our comfort zone will be better.
Certainly. Yeah.
So I think legislatively we have to work on that,
Well, we'll see. I know being in the addiction profession that it's my job to do that kind of research and to educate people on what is abuse, what is addiction, and what is not abuse, and what is not addiction. And so, we'll all be doing our homework, won't we?
Well, it's interesting because there are a series of long articles in the Daily News.
Right.
They've had 2 so far. taking up 2 whole pages and more, talking about rehab centers
Right.
and the kinds of things that go on there,
Right.
and how you can get in there. And sometimes people let themselves out after a couple of days or a couple of weeks, and they aren't completely recovered, but they don't realize that.
Well, it certainly is. It certainly is a difficult population to work with.
Oh, I can imagine.
Can be oftentimes frustrating. There are so many nuances to addiction, and it is such a complicated disorder that that it's, you know. I remember when I was in school to get my certification to be an addiction counselor, my professor had said, we as a whole are going to run into the widest range of pathologies with the least amount of training. You know,
There you
and
go.
that is the truth, right? And that is the
Very
truth.
true.
And so it's a difficult population to work with.
Well, you know, we need to take a little break, but we will be back in a moment to speak with Bob Sherritt, founder of Way Out Recovery Center. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, KHTS. Welcome back to the Senior Hour. I'm Barbara Cochran with my co-host, Dr. Jean Dorio, on your hometown station, KHTS. And we've been speaking with Bob Sherritt, and he is founder of Way Out Recovery Center. And it's located in the Santa Clarita Valley.
That's correct.
Bouquet Canyon, and 661-296-4444 is the phone number. And that's an easy number to remember.
Yeah, that is an easy. You know, we've put it out there. All fours ask for help. You know, it's like it's a nice. It is a very, very nice number, and so it's easy to remember. 296-4444. You know, call us. Call us.
In the last few minutes, we'd just like to talk a little bit about senior addiction, and you had some statistics related to that, you stated.
I do. I did a little bit of research. You don't want to talk about how all 3 of us are left-handed?
I think actually our listeners
Isn't
hear
that
it
cool?
so much,
Isn't that cool?
That's unusual. Really
but that's
is.
not an addiction, thank goodness.
Yes.
I don't think.
Well, I don't know.
that I know
I
of.
think it sets us apart.
Well,
but I
it
don't know
depends
that-
on how you write.
That's right.
Most left-handed people write upside down.
Right. I
Curl,
don't.
they curl, but
Yes.
I don't
But
curl.
I don't.
was,
I don't.
I was taught when I went to school in England, you keep your figures up straight.
Right.
If you're
Right.
left-handed or right-handed, you write up straight. And that's what I learned.
Well, I did a little bit of research on older adults and addictions, and it primarily falls into 2 categories, although that's not exclusive. Medication and prescription abuse and misuse, and alcohol abuse and misuse. Those are the primary drugs of choice, if you will, for those that fall in the older adult category. Interestingly enough, in a National Institute on Drug Abuse study, approximately 13% of the United States population is considered to be an older adult. However, 40% of all prescriptions that are written to that same population. So it's a very small percentage of the entire population that is getting a very big percentage of the prescriptions. And some of the reasons that it's so difficult is older adults are prescribed more. Improper use takes place as a result of many different things. There's a lot of pills to take in one day, and we can forget. Another factor that comes into play is because many people are on fixed incomes and prescriptions can cost so very much that there is sort of a trading or barter system that goes on. Oh, I have these old prescriptions I don't use anymore.
Share.
And so there's some sharing going on, and there can be a lot of misuse and things like that going on as well. And when, you know, one of the things that I don't know if we like to face it or otherwise, but as we get older, we start to feel our pains.
That's it.
And so it's more.
Take a drug, I'll
It's
feel
more
better.
likely for me to be prescribed some sort of a pain medication. And like you mentioned earlier, opioids can be very, very dangerous. Can be very,
Yes,
very
they can.
dangerous.
You know, they do work, but
Yes.
that the side effect, the big side effect, because they won't call it a side effect, is addiction to it.
It is, yeah, correct.
So we're happy that we could use these drugs. You know, as a medical doctor, great, but you know, I don't want my patients addicted to these medications, not at all. And
Well, the other thing too, Gene, is destroys so many different parts of the body internally.
Well, and
You know,
that's
the liver.
correct.
That's really affected by opioids.
So now you have somebody who's already in the later stages of life that have parts of their body that are not working so well, and then we throw medications on top of that that have also adverse effects in terms of adverse medical complications. So now we have liver problems, we have ulcers, we have stomach problems, we have heart issues, we have memory loss, all that stuff that goes along with drug use as well.
And we're coming to the end of our show, but I do want to mention that, Bob, you have a show on Mondays at 12 o'clock, so I want our seniors to please listen and get more information from there as well. And it's been great having you on the show. Yes, our listeners know we're all left-handed here.
That's right. That's right. We only have left-handed guests on our show.
How about that? But anyway, it's a pleasure. And well, I'm sure we'll have you back on again. The Way Out Recovery Center, 296-4444 for recovery. Appreciate it, Bob. Thanks for being on the show today.
All right. Thank you, guys.
We are sponsored by Comfort Keepers In-Home Care and Advanced Audiology. Listen to us next week on the Senior Hour. Now go and enhance your quality of life.